Hi, my name is Christian Flotter and thank you so much for joining me. Today I'd like to talk a little bit about how manual therapy may be able to help with breastfeeding difficulty. Breastfeeding difficulty is a very common occurrence in Australia. Over 90% of mothers initiate breastfeeding when their baby is first born, but this number drops off quite quickly. By 4 months of age, only 50% are continuing to do so. In fact, by 6 months of age, around 15% of babies are only being exclusively breastfed. Now, there are many reasons behind this. One of the most commonly cited reasons, though, is difficulty with the attach or suck and swallow. So, how may chiropractic or osteopathy or physiotherapy, how may manual therapy actually influence your baby's ability to breastfeed? Now, several years ago, a chap by the name of Hornby found that in kids who were having a lot of reflux behavior, difficulty with swallowing, coughing, choking, gagging, that kind of stuff, there was a dysfunction in one particular nerve, the vagus nerve, and its control of one particular muscle, the lower esophageal sphincter. Now, this muscle is what helps to keep stomach content down inside the stomach there. And without that one working properly, stomach content comes back up. But other functions of this vagus nerve are involved in this area here. See, breastfeeding itself is a really complicated process. There are over 60 pairs of muscles involved in just breastfeeding alone. Think about it, we smile with only like 15. Here, feeding takes 60. There are half of our cranial nerves, the nerves involved in a lot of background function with what we're doing, involved in breastfeeding. So there are many points at where this could start to go a little bit pear-shaped. As a chiropractor, as a manual therapist, we assess different functions of the musculoskeletal system. Now, this might include assessing the way the jaw works, assessing the way the neck works. We also assess the way the tongue is functioning. Now, if I'm unable to open my mouth properly because of, say, a jaw restriction, then this is going to influence the ability of me getting the breast into the mouth properly and feeding using my jaw, creating that nice rhythmic motion. If I have a bit of a problem inside my neck, this could create a twofold issue. Firstly, who's tried eating when you're in a bit of discomfort? Not always super pleasant. But secondly, the upper part of our neck has a very strong influence over the function of those cranial nerves. If those cranial nerves aren't working properly, our swallowing, our feeding process becomes somewhat more uncoordinated. This is where we might see choking or spluttering, or the kids dribbling milk down the sides. These are some of the indications of a bit of a neurological based issue. But further than that, what if we've got a bit of a restriction in our neck and it's stopping us from being able to turn properly towards one side? This might create an issue where we're feeding better on one side compared to the other side. Or they become really wiggly and fussy and they're just not getting comfortable. And this in turn also creates an issue when it comes to breastfeeding. Your health professional can assess for these things. We can look and assess, is there a change in normal range of motion inside your child's neck that may indicate a bit of a breastfeeding problem? The research that we completed a couple of years ago, we looked at kids who had difficulties with breastfeeding, and over the vast majority had problems inside the upper part of their neck. Could your child have a bit of a problem in their neck that's influencing its breastfeeding ability? Have a chat to your health professional. Your IBCLC or lactation consultant can also perform general motion assessments. But if you are concerned and you think that this could be an avenue worth addressing, then please get in contact with your health professional and get your child further assessed. If you have any further questions though, you can always ask Dr. Christian.